We are being compensated by Sanofi to share our story. I'm Molly, and between my husband and I, we have 5 kiddos. Aubri is my oldest.
I like to sing and travel with my choir, and I also like to read different books.
I've worked at the Diabetes Care Center for about 10 years as a nurse, long before Aubri was diagnosed with stage 2 type 1. Aubri's diagnosis with stage 2 type 1 was a fluke, to be honest. We were sitting around at a birthday party checking our blood sugar, probably something only people in diabetes management would do, and decided to check Aubri's blood sugar. When she did, the value was abnormally elevated. I brought her to my office the next day to do lab work for autoantibodies. A few days later, her lab results came back and she was positive for multiple autoantibodies and abnormal glucose levels. I was shocked. I couldn't believe that this was my child. I've worked in diabetes management for a long time and I never saw it coming. Everything went blank. I didn't know what to do. I was in complete shock that it was my child this time. From that point forward, I knew what life would look like for Aubri. And then I heard about TZIELD through education at my work. Because I see the effects of diabetes every day at work, I knew I would do anything to give Aubri possibly more time without the effects of stage 3 type 1 diabetes. When TZIELD launched, I got together with her doctor and started working out things with the insurance to be able to get TZIELD for Aubri. I learned that the most common side effects were rash, leukopenia, which is a decrease in white blood cell count, and headache. I also learned that TZIELD may cause serious side effects, including cytokine release syndrome and lymphopenia, which is a decrease in white blood cells.
My mom actually was the one that did my infusion since it was part of her job, so it made it a little bit better.
We did it over Christmas break, so she only had to miss 2 days of school. Day 1 went really well. She napped during the infusion. It wasn't until about day 6 or 7 that I started to notice some emotional changes in her. She was having to have her IV site moved every couple of days, and she was having to have lab draws as well. She was just really tired of being stuck so much.
To be one of the first to take the infusion was scary because I didn't have a story to what happens. But after it was it made me happy to know that I was gonna be that story for somebody else when they first took it.
We celebrated with party poppers on the last day of infusion. We took a really cool picture with all 14 of her empty vials, and we went to the dinner of her choice that night. Aubri's TZIELD infusions were 16 months ago. Her blood sugars have been stable since. We can't say for certain where things would have been without TZIELD, but I can say she's still not on insulin. If I could go back and start from the beginning of treatment, I would tell myself, it's worth it. Just hold on, it's worth it. Put things in perspective and realize that 14 days of infusions is really a short amount of time in comparison to the potential amount of time you could give your child from progressing from stage 2 type 1 diabetes to stage 3 type 1 diabetes.
What is TZIELD? TZIELD is a prescription medicine used to delay the onset of stage 3 type 1 diabetes, which is when your body can't make enough insulin on its own and may require insulin injections. TZIELD is for adults and children 8 years of age and older who have stage 2 type 1 diabetes. This means that they have tested positive for 2 or more type 1 diabetes-related autoantibodies, have abnormal blood sugar levels, and do not have type 2 diabetes. It is not known if TZIELD is safe and effective in children under 8 years of age. Important safety information. What is the most important information I should know about TZIELD? TZIELD may cause serious side effects. These include cytokine release syndrome, CRS. Signs and symptoms may start during the first 5 days of TZIELD treatment and could include fever, nausea, feeling tired, fatigue, headache, muscle and joint pain, or increased liver enzymes in your blood. Tell your healthcare provider right away if you develop any signs and symptoms of CRS during treatment with TZIELD. Decrease in white blood cells. TZIELD may cause a decrease in a type of white blood cell called lymphocytes. A decrease in white blood cells is a serious but common side effect that can affect your body's ability to fight infections. A decrease in white blood cell counts can happen after your first dose. Your white blood cell counts will start to go back to normal after your 5th dose of TZIELD. Some people may develop longer and more severe decreases in lymphocytes. Your healthcare provider will do blood tests to check your liver and your complete blood counts before you start treatment and during treatment with TZIELD. During and after your treatment with TZIELD, your healthcare provider will check for serious side effects as well as other side effects and treat you as needed. Your healthcare provider may temporarily or completely stop your treatment with TZIELD if you develop liver problems, have a serious infection, or if your blood counts stay too low. What should I tell my healthcare provider before receiving TZIELD? Before or after receiving TZIELD, tell your healthcare provider about all your medical conditions, including if you have a serious infection or an infection that does not go away or keeps coming back, have recently received or are scheduled to receive an immunization, vaccine. TZIELD may affect how well a vaccine works. Tell your doctor that you are receiving TZIELD before receiving a vaccine. Are pregnant or plan to become pregnant. TZIELD may harm your unborn baby. Do not receive TZIELD during pregnancy and at least 30 days before a planned pregnancy. Are breastfeeding or plan to breastfeed. It is not known if TZIELD passes into your breast milk and if it can harm your baby. Talk to your healthcare provider about the best way to feed your baby if you receive TZIELD. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of TZIELD? The most common side effects of TZIELD include rash, leukopenia, decrease in white blood cell counts, headache. These are not all of the possible side effects of TZIELD. Talk to your healthcare provider for more information and tell them about any side effects you notice. You may report side effects to the FDA at www.fda.gov/medwatch or 1-800-FDA-1088. Please see accompanying medication guide and prescribing information. To learn more, visit www.tzield.com.